Hi guys, it's me, Princess Becky XO, and welcome back to my YouTube channel. So I've been working on this project for my public health class about at-risk populations, and it's actually been really tough, so I thought I'd let you guys in on this journey with me. I'm doing this project with my sweetest, bestest friend, Stacy. Come here, Stacy. Say hi to the camera. Okay, you can go now. We decided to do this project on the LGBT community because, to be honest, I don't really know that much about them, but I need a Bretman rock in my life without being problematic. So what's going to happen in this video is Stacey's going to go through the background with you guys, and I'm going to interview people on the street to find out what they know about the LGBT community. Without further ado, let's get started. Hey guys, it's Becky, and here's my friend Stacy. She's going to be doing the whiteboard presentation for you guys. Alrighty, Stacy, you got this.
What's up, YouTube? It's Stacy, and let me tell you, I love gay people just as much as the next person, but this is a lot of work and I suck at illustrating, so Becky, you really owe me one. Anyways, let's get on with the presentation here. The population we are discussing is the LGBTQIA community, aka lesbian, gay, bisexual, transgender, intersex, and asexual, which represents individuals of varying sexual orientations and gender identities. A record 4.5% of American adults are identified as lesbian, gay, bisexual, or transgender, according to a new Gallup estimate. Between 2012 and 2017, women who shared that they have been calling themselves LGBT went from 3.5% to 5.1%. For men, it went from 3.4% to 3.9%. The increase was driven primarily by millennials, defined as those born between 1980 and 1999. In 2012, 5.8% of this cohort said they personally identified themselves as lesbian, gay, bisexual, or transgender. In 2017, it estimated that the number jumped to 8.2% of millennials. In contrast, Gallup found that the older generation's rate was steady when it came to LGBT identification. In the latest survey, 3.5% of Generation X respondents, which were those born between 1965 and 1979, were identified as lesbian, gay, bisexual, or transgender. 2.4% of baby boomers, which were those born between 1946 and 1964, and 1.4% of traditionalists, which are those who were born before 1946. Since 2012, the LGBT percentage has risen among all race and ethnic groups, with Hispanics and Asians having the highest increase. With the growth of the LGBTQ+ community in recent years, an increase in challenges against this community has also been present within the United States. In March of 2016, North Carolina issued a bill banning trans youth from using the bathroom aligned with their gender identity and restricting their access to the facility corresponding with their gender assigned at birth. This event sparked a controversial debate across the nation over LGBTQ+ community members and their rights. This issue affects public health because it would restrict LGBT individuals from using the restroom in public, as well as potentially creating a dangerous situation for LGBT individuals who choose to use the restroom for the gender in which they identify. Several states, including California, have since implemented changes to public restroom policy in order to promote equality. California was the first state in the nation to require all public restrooms be updated with a single toilet or urinal to be labeled gender neutral. The LGBT+ community has faced several ethical and legal dilemmas. There is evidence showing that homosexuality has been practiced in every documented culture. Homosexuality existed in ancient Jerusalem simply because it was prohibited in the Bible, whereas it flourished between men and women in ancient Greece. From the lyrics of same-sex desire inscribed by Sappho in the 7th century BCE, to youths raised as the opposite sex in cultures ranging from Albania to Afghanistan, from the female husbands of Kenya to the Native American two-spirit, alternatives to the Western male-to-female and heterosexual binaries thrived across millennia and culture. Homosexuality has been around for nearly 400 years in the United States. Up until the 21st century, LGBTQ individuals were labeled as outsiders, minorities, aliens, and more. They were discriminated, outlawed against churches and governments, and were even categorized as a psychiatric disorder in the 1952 APA Diagnostic Manual. By the 1900s, movements for social justice and equality had been underway, encouraged by the activism of other social movements such as feminism and farm worker equality. Some notable organizations and unions fighting for LGBTQ rights are the Society for Human Rights, the Mattachine Society, Daughters of Bilitis, or DOB, The Advocate, Lambda Legal, and Parents and Friends of Gays.
All right, Stacy, it's my turn. Hey guys, it's Becky. I'm going to talk about the psychosocial concerns. In 2017, 1,524 victims of hate crimes were attacked due to their sexual orientation or gender identity. The prevalence of hate and discrimination has decreased in the past decade. However, numbers are still alarmingly high and are a concern for our vulnerable population. LGBTQ individuals are 3 times more likely than straight individuals to attempt suicide at some point in their lives. Each time an LGBTQ member is a victim of verbal or physical abuse, they are 2.5 times more likely to hurt themselves. Issues of safety, mental health, and substance abuse are of concern for this population and must be addressed appropriately. Now we're going to discuss the economic concerns. A new report on LGBTQ poverty in 2017 highlighted that LGBTQ members are more likely to live in poverty than their heterosexual peers. Indicators of economic disparity, including food insecurity, housing instability, low wage earning potential, and unemployment and underemployment, are all heightened for LGBTQ communities. Out of 14% of the unemployed population, 9% are LGBTQ members. Out of 42% of the food insecure population, 27% of those are LGBTQ members. Out of 43% of the population living with less than $24,000 annual income, 25% are LGBTQ members. Non-heterosexual individuals are more likely to drop out of school and not finish their degree due to the unsafe climate created in the classroom. This in turn leads to lower education levels, low literacy, and lower numbers of these individuals in higher earning careers. In 2015, LGBT business entrepreneurs contributed over $1.8 billion to the U.S. economy. Average LGBT business entrepreneurs have been in business for over 12 years. This is far above the national average, as a majority of small businesses tend to close down within the first 5 years. Hey guys, it's Becky again. Now we're here on campus and we're going to start interviewing random people on the street and see what they know about LGBT. Hey, there's someone right here. Hey, come over here. Are you busy? Can I pull you for an interview?
I mean, it's not like I wasn't busy or anything.
Great. So let's go over to the stage because you're all sweaty and gross. And let's just go. Hi, I'm Becky, and you are?
Rebecca?
Oh my God, that's so cool. Becky, Rebecca. So I'm doing an interview about LGBT people, and I'm just asking people that just walk by what they know about them. So do you know anything about them?
I mean, I know a few things about them. I know that they face societal stigma, discrimination, and denial of their civil and human rights. That causes them to have health concerns like psychiatric disorders, substance abuse, and suicide. Young LGBT people are 2 to 3 times more likely to attempt suicide due to bullying, and they're more likely to be homeless. They experience violence and victimization, and that have long-lasting effects on the individual and the community itself.
That's actually really sad.
Yeah, and it doesn't stop there. When it comes to acceptance, whether it's personal, family, or social, it affects their mental health and personal safety, because they couldn't just hang out freely at home or in the public bars and clubs, where the only place LGBT people could go and be themselves. And bars and clubs mean alcohol too.
I'm not 21.
I can tell. Anyway, LGBT has the highest rates of tobacco, alcohol, and other drug abuse. Not only that, each type of LGBT person has their specific health concerns. Gay men are at higher risk of HIV and other STDs. Lesbian and bisexual females are more likely to be overweight, obese. Lesbians are less likely to get preventative services for cancer. And LGBT individuals face additional barriers to health because of isolation, lack of social services, and culturally competent providers.
You seem like you know a lot.
Yeah, I just try to stay educated, I guess.
Right, because knowledge is power.
Sure.
Okay, great. Thank you, Rebecca. It was nice meeting you. So it seems like people know a lot here, and I'm really excited to hear from more of them, but it doesn't seem like they want to be interviewed. So I think I'm just going to go up to someone and ask them my questions. Let's go over here. She looks really, really nice. Hi. Hi. Can I pull you for an interview?
Well, I heard you interviewing that other person, so just get on with it.
Okay, cool. Okay, so tell me what you know about the LGBT community.
Well, LGBT health can definitely be improved, like education on condom use, long-term effects from tobacco use, illicit drugs, binge drinking, nutrition, weight status, and alcohol use would be really helpful. They should be screened too, like breast cancer screenings, cervical cancer screenings, HIV testing, and other STI screenings. And since their mental health is a prevalent problem, they should seek care for that and make sure they continue with their medication regimen or speak to a therapist for help about the emotions that they're experiencing. If they have a problem with drug and alcohol abuse, they should attend a rehab center or a one-step program. Anti-bullying policies in schools and providing social services would help too. Other things that can improve LGBT health are collecting health-related surveys and health records so that health disparities can be identified. Specifically in a healthcare setting, being supportive of a patient's sexual orientation and gender identity would really help enhance the patient-provider interaction. For their actual physical environment, some things that would really contribute to the health of the LGBT individuals would be access to safe schools, neighborhoods, housing, recreational facilities, and activities, as well as availability of safe meeting places and health services. Long story short, inclusivity.
You're like really smart.
Thanks.
I've been learning a lot today, and I'm really ready to learn from some more people. So let's walk around and see who we find. Hey, how about her? She looks really professional, and she's taking notes right now. Let's see what she has to say. Hi there.
Hi.
Can I pull you for an interview?
Sure.
So, I'm doing a project for public health, and
Really?
yes, why? What's up?
Well, I'm actually a public health nurse, and I'm assessing the community right now.
That's great. Can I actually pull you aside and let's sit down and talk about this?
Yeah, let's sit down.
Okay, great. So you're a public health nurse. You know everything. So tell me everything.
Okay, well, let me start by letting you know what public health nursing is. So it's defined as the practice of promoting and protecting the health of populations using knowledge from nursing, social, and public health sciences. Public health nursing focuses on the population health with the goal of promoting health and preventing disease and disability. Public health nurses implement primary, secondary, and tertiary methods of prevention into the care of the population. So examples of primary prevention is education on safe sex practices, educate on HIV and AIDS transmissions and the signs and symptoms, educate on STI transmission, and screen for substance abuse disorders. Examples of secondary prevention are screening for mental health issues, STIs, HIV and AIDS, pap smears, emergency contraception, and emergency treatment for STIs or other communicable diseases. Tertiary prevention is actual treatments, so treatments for STIs, HIV/AIDS, treatment for substance abuse or rehab, medications, and support groups. There are 3 core functions of public health, and those are assessment, policy development, and assurance. So for the assessment, you're using systematic methods to monitor the health of a population. So, for example, you can assess the local LGBT community for any health concerns, monitor the health status of the LGBTQ community, and diagnose and investigate health problems within the community. For policy development, that is developing laws and practices to promote the health of a population based on scientific evidence. So for that, you want to advocate for increasing access to healthcare. provide opportunities for LGBTQ plus members of the population to discuss their concerns, and also develop policies and plans that support those LGBTQ members and their community and their health status. Assurance is making sure adequate healthcare personnel and services are accessible, especially to those who might not normally have them, like LGBTQ individuals. So you're going to want to enforce the laws and regulations that protect them and their safety. You can refer them to health services, and you also have to ensure that there's a competent healthcare workforce, and then evaluate the effectiveness of those health services. So there's a lot of resources out there for the LGBTQ community, and one of those resources is Planned Parenthood. They offer several services, including a drop-in center, providing education, and even starting hormone therapy for transgender patients. They have multiple clinics, and you can find the nearest clinic by going onto their website. Another resource is the Los Angeles LGBT Center, and there is a great resource for the LGBT community. They offer a wide variety of services, including physical and mental health, primary care for both men and women, and specialized care for HIV or addiction. They also offer transitional housing, employment support, and other legal services. Another resource is Bienestar. Bienestar is a community-based healthcare and social services organization in the greater LA area, but they have several locations. Their expertise is identifying and addressing emerging health issues faced by the Latino and LGBTQ populations. There are, however, additional resources that are needed in the LGBTQ community, such as emergency housing for those who are kicked out of their house or who run away because they are LGBT and their family may not accept them. Another is a potential need for LGBT centers in the Inland Empire, because most of the centers and resources are found in Los Angeles and Orange counties.
That was really cool, you guys. Okay, guys, last interview of the day. I'm really learning a lot, so let's go talk to this person. Hi there.
Hi.
Can I ask you a couple questions?
Sure.
So, can you tell me what you know about the LGBT community?
Have you heard of transgender homicide?
No? Alright, guys, it's Becky again. I looked up transgender homicides, and it turns out the problem is way more serious than I actually thought. So here's what's going on with transgender homicides. Since 2013, more than 130 cases of anti-trans violence have been documented. And just in 2019, 19 transgender people have been killed by violent means. The people who have been committing these crimes are actually partners, acquaintances, and strangers to these victims. These incidents mostly impact trans women of color. There are three main factors as to why this might be happening. The first one, anti-trans stigma. These include lack of family acceptance, hostile political climate, cultural marginalism, and invisibility. The second one, denial of opportunity. Setbacks in education, employment discrimination, barriers for refugees, immigrants, and asylum seekers, exclusion from health and social services, unequal policing and justice system, and barriers to legal identification. And the third one, increased risk factors. These include intimate partner violence and sexual assault, engagement in survival sex work, poverty and homelessness, and physical and mental health disparities. So what does this do to the LGBT community as a whole? Well, for starters, it instills fear into the transgender community. It brings more awareness to the factors that lead to this violence, but at the same time, it strengthens these factors. The reason behind this is because anti-trans stigma, denial of opportunity, and increased risk factors all coincide, and one often leads to another. So what do I think about all this? I think it's pretty up. Sorry guys, don't know what came over me. I think it's messed up, to say the least, and more education should be done in the community. People are being killed for simply wanting to be themselves, and to say that it's kind of messed up is saying the least. Transgender individuals shouldn't have to be scared that they're going to be killed because of the fact that they're transgender. So how do we fix the situation? Simply put, education and advocacy. So for education, just educating family members, students at schools, educating just the public about transgender people, making sure that they're visible, creating safe spaces for transgender youth, advocating for transgender inclusive policies and anti-bullying laws, making sure that health care is available to these individuals, expanding access to transgender inclusive health services for youth, enhancing services for low-income and homeless populations, raise awareness of the issues that transgender people face, and changing the narrative surrounding transgender identities. Those are all slightly general and simply put solutions to a big problem. So that's what I learned about transgender homicide. But anyway, guys, this has been Princess Becky XO. I hope you learned a lot from this video because I sure did. Don't forget to like, comment, and subscribe. And as always, thanks for watching.
In conclusion, the LGBT community encounters a lot of stigma, discrimination, and denial of their civil and human rights.
There's still a lot to be done in order to change the problems this community faces. This includes education, inclusivity, more access to resources like housing, healthcare, and sometimes it's even as simple as recognizing these people do exist.
And the only way we can make this happen is through change.
And the change starts with you. Let's not, just kidding. No, let's not do that.
That's freaking.
It's the real me came out.
The last is just.
That happens every single time. And change starts with you. Okay. Oh, this is like a butt. This is like a butt.